So my name is Ewelina. I'm doing high-level apprenticeship training assistant practitioner program. I work in University Hospital Plymouth in critical care. Obviously, I'm a mature student, so I was already at work and I was working in place what I wanted to be. I always wanted to work in hospital. So that kind of felt like perfect opportunity just to kind of the next step on the ladder to go to work in critical care, which was my always dream, I would say. Yes, it just felt like perfect opportunity. So I think it's easy to talk about a week because there's never a typical day in intensive care. But a typical week, it's a kind of juggling university and work. So we will work 2 days a week or 3 days a week some weeks. 1 day at university. And once a month we have like critical care foundation training as well. So we kind of juggling that. So it's a 12-hour shifts and university days. So university is really brilliant with like giving us calendars in the like on the beginning of the year, so you can still kind of plan your life, you plan your holidays, and they are very, very. It's very important to have your work-life balance in check, and it's the same from work. Work will kind of encourage us to keep our mental health, and encourage us to look after ourselves and go on holidays and have our breaks. And so it's not as difficult as it sounds, actually. So there is lots of support. I start with Marjon. I mean, you have learning and development support. You can have support from library staff. You have support from your personal tutor. You have support from your program leader, from our apprenticeship coach, from student support. So it's very much whatever you need, you just need to voice it, and it's very much tailored to your needs. So, for example, somebody who will suffer from dyslexia may just need a program who help them take notes. Someone else who suffers with anxiety, for example, may just need a mentor just to kind of guide them through, and they will have a meeting, for example, once a week to have a chat and see where are you and how is life going. So it's lots of support around us. There's support from library staff, for example, with just checking your referencing skills. At work, we have, critical care is very positive, have very positive learning culture. So we have support from our education team, which are absolutely fantastic. And we have support from our manager, which he really understands that there's lots of pressure on us, in a sense like we have deadlines at university and we have lots to learn at work. And they understand that the more they teach us at work, the more opportunity they give us, then the better we will be when we qualify. There's absolutely plenty. I mean, my first proud moment is when I went through the interview and I actually got the job. That was the first. But then it's every day there are little things which are actually kind of, there are little things, but they're becoming a very big thing. Like you happy when you first time understand the. I was happy when I first time thought to myself, yes, I know how my day looks like in critical care. I know how to structure my shift. First time when I properly felt like I'm advocating for a patient and I can see my mentor standing next to me and approvingly kind of nods his head. First time when I felt like, yes, I can speak up, and yes, I can give very comprehensive handover to my colleagues. Yes, I can do an assessment on my patients, and I feel confident about it, that I know my job. I do it well. It's a proud moment. I think work experience is, when you're at work, you naturally developing those skills like communication and teamwork. And then at university, you learn kind of why behind it. So then you understand, we're doing this because every policy is not just a policy anymore. That's evidence-based practice. We know where it comes from, and it's so much easier to follow. When you understand your whys, it's so much easier to follow. And also, it's kind of like complementing each other, work and university, because when you go to immerse room, it's so apparent when the way we use our skills learned in the workplace, the way we communicate with each other, our teamwork is really, really good. And we didn't know each other before, so, it's really impressive how we can kind of use those skills. So I used to think that apprenticeship is just for young people and you earn very little, next to nothing money. And that's not true. We are Agenda for Change, and they just scale of pay, and we earn just a normal wage. our university hours and incorporated with our full-time hours. So that was my first myth. And I always thought you have to be kind of younger to do it, but actually age really doesn't matter. Any time is good. Absolutely do it. I wish I'd done it early. I wish I found Marjon early and done it early. Especially if you're thinking like you learn, especially if you think I'm not great academically perhaps, and you learn more with hands-on, then that's apprenticeship, then it's perfect for you. But even if you think I'm brilliant academically, I don't want to lose out, you would not, because university give you so much opportunities, and they really gently push you to encourage you to kind of grow. I would definitely like to continue to full degree in critical care. My ultimate dream is to have master, but one step at a time. Well, I have plenty to say to my 15-year-old self. I would say, believe in yourself. You can really do whatever you put your mind into, and you're going to lose a couple of times, or more than a couple of times, but you're going to be surprised how much you learn from your fail attempts. Just perfection is never the ultimate goal. Just keep going and trying like it's your first time. Just shake it off and try again. And you got this, girl. I believe in you.
Hi, so I'm Chloe. I'm one of the trainee assistant practitioners. I'm on one of the higher level degree apprenticeships at Marjon, doing a foundation degree, and I work at University Hospitals Plymouth. I think for me, I was already working in the hospital, and the idea of sort of coming out of work and having to go to being a student and take that time out didn't suit me. And the opportunity just presented itself at a brilliant time where I think I wanted to progress roles and really change what I was doing. So it fitted me perfectly to be able to work and study alongside that. No day is the same at work. Personally, being based in critical care, intensive care, it very much can be completely different every single moment, let alone day. Um, Generally, our week's filled with, we have one day at uni, and then a few shifts a week working clinically in between, and then that underpins what we do at university. We're really lucky that between the university and our work, they're really supportive about what we do. So actually, if we need more time with support, study support, then we have that. And the university is very good at understanding that we work what can be quite a hard and testing job from time to time. So they're really understanding that what we do can take its toll on us as well. So actually, when we're studying, it's enjoyable, and I really look at my university days as a bit of a relief day. It's almost like that's my fun day to just enjoy what I'm doing. I actually, I've said this before to a few colleagues, but I almost feel like there's almost too much support in some ways, because every corner you turn, there's somebody there to help you. And I don't think I've ever experienced that before. So even down to wellbeing support at work and at university, our apprentice coaches, our lecturers, our mentors at work, and our education team at work as well. We've kind of just got people every which way you turn. I can be quite hard on myself sometimes not to look for that. I don't think I always appreciate those moments, but actually, I think each day and the more I'm progressing, it's more of a reflection when I feel proud of myself. So down to being in work and doing a task that actually I was struggling with a few months ago, or having the confidence that my mentor can leave me to do the jobs that beforehand I needed more supervision with, and actually they're like, no, you've got this and you can do this, and I get that push, and that really makes me feel quite proud of myself and glad that I'm actually achieving these things I wanted to achieve. It's really beneficial to my learning, actually being able to work and carry things out practically. I don't think I would have managed doing things just on paper, so having that practical element to my training and really underpinning those skills in my practice has been key to how I've developed as a learner and as a professional. I don't actually think I paid much note to them, in all honesty. I don't think I was aware of the vast availability of them, actually. So I for me, I think I was always in that headset of, oh, if I need to train, I want to do more, I'm going to have to leave work, I'm going to have to become a student and go through that whole process. And actually, there's a lot more available via an apprenticeship and working route nowadays. And that's been brilliant for me in my training. I'd probably just say do what you enjoy. And actually, if there's something you want to do, there's probably more than just one way to do it. Just going off my personal experience as well, and just you don't need to know what you want to do, but actually, if there's opportunities to work alongside things, go and do it. It's the best way to learn. I'd really love to do my nursing and top up on top of the training I'm doing now and be able to just progress within my department and my role. And yeah, just try and work up towards that professional certification and training. I'd say don't panic too much about sticking to the normal path, and actually that doing what you want to do is fine, and you don't need to be ticking all the boxes, and just go with the flow and enjoy what you do, because actually it'll take you to where you want to go.